Equine herpes virus, EHV, known as equine rhinopneumonitis, is a highly infectious alpha herpes viridae found virtually worldwide. There are currently 3 known EHVs. EHV-1, EHV-3, and EHV-4 in the horse population. EHV-1 and EHV-4 can cause upper respiratory disease, neurological disease, abortions, and/or neonatal death. EHV-3 causes a venereal disease called coatal exanthema. In recent years there has been an increase in the number of EHV-1 neurologic cases, also referred to as equine herpes myeloencephalopathy, EHM. The virus incubation period is highly variable and can be as long as 14 days. Prognosis is good for horses not affected with the neurologic form and varies for those with neurologic signs. Clinical signs, EHV-1 and EHV-4. Clinical signs may be nonspecific and some horses may be non-clinical to have the following: fever, difficulty urinating, nasal discharge and cough, depression, head tilt, loss of tail tone, stumbling or weakness in the hind limbs, may progress to all limbs and go down and be unable to rise to stand. Transmission of equine herpes virus, EHV-1 and EHV-4, is spread via nose-to-nose contact, contaminated equipment, water and feed buckets, tack and grooming supplies, and shoes, and respiratory secretions within stalls, stables. Aborted fetuses and afterbirth can also contain the virus. EHV-3 is spread through venereal transmission or contaminated equipment used for breeding. Treatment of equine herpes. Treatment consists of supportive care, which may include fluid therapy and anti-inflammatories to reduce fever. In more severe neurologic cases, treatment may require hospitalization with more intensive veterinary care. The majority of horses with uncomplicated infections recover. Prevention of equine herpes. Vaccines are available to prevent the respiratory and abortion forms of EHV, but none are labeled as effective against the neurologic form of the disease, EHM. Vaccination may reduce the severity of clinical signs and may lead to reduced viral shedding. In breeding operations, the use of vaccination appears to be effective at reducing the risk of EHV-1 and EHV-4 abortions, and its use is strongly recommended. Pregnant mares with foals at their site should be kept in small groups and prevented from contacting new introductions. Isolate new horses for a minimum of 21 days, 30 is strongly recommended. This includes returning horses who have left the farm to attend any event. Practice good hygiene and biosecurity.